What is a CBCT scan? A 3D cone or pyramid shaped divergent X ray beam is directed through the patient onto a detector. During exposure, the X ray generator and the detector rotate around the patient's head. Scan time can be as fast as 5 seconds to 20 seconds. Most CBCT units have a small footprint enabling office placement. Patient's head must be immobilized to get a good final image. Then the end result is 3D visualization of oral and maxillofacial complex from any plane. A stack of 360 images or exposures compiled into a volumetric dataset through a computer process known as primary reconstruction. This data volume is then converted into a patient study by accompanying software. It can be visualized as 2D, transaxial, multiplanar, reformatted, 3D techniques such as surface reconstruction and volume rendering. Now, there are different varieties of cone beam maxillofacial imaging systems such as ICAT, Illuma, DCT, VCT. Now, there are four different kinds of CBCT reference planes. One is axial, other one is sagittal, coronal, and transaxial. The coronal slice is like just you are looking at the patient from the front, almost like a panoramic. So, the left side of the screen is actually the right side of the patient, and the right side of the screen is the left. So, it's like they're looking at you, it's just like a panoramic view. We've got the axial view. So this is like you are looking at someone, you're looking up at someone from below. And again, the left side of the screen is the right side of the patient, and right side of the screen is the left side. Then we've got the sagittal view, which is just from the side. Then there are series of cross-sectionals or transaxials. Cross-sectional image of an area can be developed with 5 to 5 mm spacing between images. Then we have the volume render, which is just a 3D model representation of the patient's skull. So this is really good for overall patient education, especially if you were to map out a nerve and then you showed that patient where the implants would actually go. So what are the indications? It can diagnose variety of infections, osteomyelitis, cysts, benign and malignant tumors, trauma in the maxillofacial region, lesions involving the bone, and it is used in the treatment of congenital and acquired deformities. So what are the advantages? Advantages is its size, that is small physical footprint. Then the cost, 1/4 to 1/5 of the cost of the conventional CT. Then it has the short scan time, most times spent explaining and setting up the patient for the scan. And high resolution imaging होता है. Fine details of structures like PDL space, root canal morphology, root fractures, relatively low patient radiation dose, and interactive analysis viewing can be done on a personal computer. Then disadvantages is it has image noise, that is artifacts, due to large portion of scattered radiation which increases with increased object thickness and image size. Hence it is advisable to have the smallest FOV possible. Software to reduce artifacts. So, and poor soft tissue contrast due to scattered radiation, FPD based artifacts. Then the clinical applications of CBCT are dental implant planning and guidance, temporomandibular evaluation, pre-surgical assessment, impacted teeth, reconstructive, orthodontic assessment, periodontics, endodontics, and pathology.